The beginning of life, before birth. Pregnancy is a carefully timed biological process that usually lasts about 40 weeks. During this time, a baby's organs develop in a precise and highly coordinated sequence. The lungs, brain, and immune system are among the last to fully mature. A full-term birth gives the baby the best chance to survive independently. However, not all pregnancies follow this natural timeline. Sometimes labor begins too early, before 37 weeks of gestation. This condition is known as premature birth or preterm birth. It interrupts the natural development process abruptly and unexpectedly. And when it happens, the baby enters the world before being fully ready for it. What premature birth means medically? Medically, premature birth is classified into categories based on gestational age. Late preterm babies are born between 34 to 36 weeks. Moderate preterm between 32 to 34 weeks. Very preterm before 32 weeks. Extremely preterm before 28 weeks, where survival becomes much more complex. Each stage carries different risks depending on organ maturity. The earlier the birth, the less developed the lungs and brain are. This is why premature birth is considered a high-risk medical condition. Immediate neonatal intensive care is often required for survival.
Why premature birth happens for many medical and biological reasons. Infections in the mother's body can trigger early labor. High blood pressure or preeclampsia can also force early delivery. Multiple pregnancies, like twins or triplets, increase risk significantly. Structural issues in the uterus or cervix may weaken pregnancy support. Sometimes the exact cause remains unknown even after medical evaluation. Stress and poor prenatal care can also contribute indirectly. Genetics and previous premature births increase likelihood in future pregnancies. It is rarely caused by one single factor alone. The moment of early delivery. When premature labor begins, the medical response becomes urgent. Doctors try to delay delivery using medications if possible. But if the baby or mother is at risk, delivery must proceed. The baby is often delivered via emergency C-section or assisted birth. Unlike full-term babies, premature infants are extremely fragile at birth. Their skin is thinner and their body temperature is unstable. Breathing may not begin naturally without medical help. A specialized neonatal team is always present.
First moments outside the womb. The first moments of life for a premature baby are very different. Instead of immediate skin-to-skin contact, medical intervention comes first. The baby may be placed directly on a warming table. Doctors quickly assess breathing, heart rate, and muscle tone. If breathing is weak, oxygen support or ventilation is started immediately. The baby is often taken to the neonatal intensive care unit, the NICU. Parents may only see their baby briefly before separation. This moment can feel overwhelming and emotionally intense. Life begins, but not in the way anyone expected. The role of the NICU. The NICU becomes the second womb for premature babies. It is a highly specialized unit designed for critical newborn care. Incubators maintain temperature, humidity, and controlled oxygen levels. Monitors track heart rate, breathing, and oxygen saturation continuously corundum. Tiny IV lines deliver nutrition and essential fluids. Some babies require ventilators to support underdeveloped lungs. Medical staff monitor every change with extreme precision. Even small improvements are considered major progress. The NICU is both a place of survival and hope.
Underdeveloped lungs and breathing challenges. One of the biggest challenges in premature birth is lung development. The lungs are among the last organs to fully mature in the womb. Surfactant, a substance that keeps air sacs open, may be insufficient. Without it, breathing becomes extremely difficult after birth. This condition is called respiratory distress syndrome. Doctors may administer artificial surfactant to help lung function. Mechanical ventilation or CPAP may be required for breathing support. Each breath is carefully assisted until the lungs strengthen. Over time, many babies gradually learn to breathe independently. Brain development and neurological sensitivity. The premature brain is still in a critical growth phase.
Neural connections are forming rapidly during late pregnancy stages. Early birth exposes the brain to external stress too soon. This increases risk of developmental delays or complications. Medical teams carefully minimize noise, light, and stimulation in NICU. Even gentle handling is done with precision and care. Brain imaging may be used to monitor development. Many premature babies grow normally with proper care. Early intervention plays a key role in long-term outcomes.
Feeding and growth difficulties. Premature babies often cannot suck or swallow effectively at birth. Their digestive system is still immature and delicate. Feeding is initially done through tubes directly into the stomach. This ensures they receive necessary nutrients for growth. Breast milk is often preferred for its immune protective benefits. However, it may be given in controlled, measured amounts. Gradually, babies are transitioned to oral feeding when ready. Weight gain is carefully tracked every day. Even small increases in weight are major milestones. Emotional experience of parents. For parents, premature birth is emotionally overwhelming. Instead of joy-filled homecoming, there is uncertainty and fear. Seeing their baby connected to machines can be heartbreaking. They often feel helpless, unable to hold or comfort their child. Daily visits to the NICU become a routine of hope and anxiety. Every monitor beep carries emotional weight. Yet, even small improvements bring immense relief. Parents slowly adapt to this unfamiliar journey of care. Bonding happens through touch, voice, and presence near
The progress of survival. Over days and weeks, premature babies slowly begin to improve. Breathing support may gradually be reduced. Body temperature regulation becomes more stable. Feeding improves as digestive strength increases. The baby starts gaining weight consistently. Medical staff celebrate each small milestone carefully. Parents may eventually be allowed to hold their baby directly. This practice is known as kangaroo care and improves recovery. Every stage represents a step closer to independence. Long-term outcomes and development. Many premature babies grow into healthy children with proper care. Early intervention therapies may support developmental milestones. Some may need monitoring for vision, hearing, or learning delays. However, medical advancements have significantly improved survival rates. The earlier challenges often do not define the child's future. Regular pediatric follow-ups ensure proper development tracking. Family support plays a crucial role in emotional stability. With time, most children catch up to normal growth patterns. Life after prematurity often becomes completely normal.
Medical advancements that save lives. Modern neonatal medicine has transformed premature birth outcomes. Advanced ventilators support extremely underdeveloped lungs. Steroid treatments given to mothers can speed lung maturation. Improved NICU technology allows precise life monitoring. Surfactant therapy has dramatically increased survival rates. Specialized neonatal doctors and nurses are highly trained. Research continues to improve care for extremely early births. What was once fatal is now often treatable. Science continues to push the limits of survival earlier each year. Final emotional reflection. Premature birth is not just a medical condition, but a journey of resilience. It begins with fear, uncertainty, and fragile life. But it often transforms into hope through medical care and patience. Every tiny breath in the NICU is a victory. Every heartbeat represents strength beyond expectation. Behind every incubator is a story of silent courage. And behind every child is a fight for life that began too early. Yet many of these stories end not in loss, but in survival. A reminder that even the smallest beginnings can hold the strongest lives.